Okay, guys, I'm going to do a bonus one for you. It's discussion E. Tonight, we're discussing a real senior crisis in the U.S. So let's get into it. Okay, that headline packs a punch, and sadly, it reflects a very real crisis, according to a 2024 survey by Payzen and census-wide. A staggering number of Americans are making extreme financial sacrifices just to afford medical care. In fact, 91% said they'd cancel a planned vacation. 75% said they would take on a second job, and 51% would even downsize their home to cover healthcare costs. But there is the kicker. 36% of respondents skipped or delayed needed medical care in the past year due to cost alone. That's not just a financial issue, it's a public health emergency. The report also highlights that Americans collectively hold about 220 billion in medical debt, and many are forced hold on to choose between financial ruin and life-saving treatment. It is a sobering look into at how affordability gaps are reshaping health behaviors and priorities. Would you like to explore how this intersects with self-directed care models or policy reforms aimed at reducing out-of-pocket costs? I think your insights on autonomy and personalized care could add a powerful layer to this conversation. Medical debt doesn't just strain wallets, it weighs heavy on minds. Studies show it's strongly linked to increased anxiety, depression, sleep disturbances, and even social withdrawal. In fact, for every $100 increase in medical debt, people reported 6.8 more days of poor mental health per month per one for 1,000 individuals. The burden is especially harsh for those already struggling. Adults with depression or anxiety who also carry medical debt are twice as likely to delay or forego mental health care compared to those without debt. That creates a that creates a vicious cycle. Debt worsens mental health, which in turn makes it harder to seek help, leading to further decline. And not just about clinical symptoms. Debt-related stress has been tied to relationship conflict, reduced optimism, and even consideration of bankruptcy as a coping strategy. It's a silent epidemic that erodes well-being from multiple angles. Would you like to explore how self-directed care models or policy innovations might help break this cycle? I think your insights on autonomy and person-centered care could really shine here. Mitigating the mental health toll of medical debt requires a blend of emotional resilience, financial strategy, and systematic support. Here are some evidence informed approaches that can help. Okay. Normalize the conversation. Shame and isolation often amplify distress. Encouraging open dialogue, whether with a therapist, support group, or trusted friend, can reduce stigma and help people feel less alone. To access to financial navigation services. Many hospitals now offer financial counselors or patient advocates who can help mitigate or negotiate bills or set up zero interest in payment plans. Identify clarity of care. Identify clarity, care, or sliding scale programs. Guide patients through Medicaid or ACA enrollment. These services are underutilized but can significantly reduce both debt and distress. Leverage mental health resources. Even when funds are tight, options exist. Community mental health centers often offer low-cost free counseling. Teletherapy platforms may provide sliding scale fees. Peer support groups, online or local, can offer emotional relief and practical advice. Avoid converting medical debt into credit card debt. Using credit cards to pay medical bills can strip away consumer protections and increase interest burdens, it's better to negotiate directly with providers or seek nonprofit assistance. 5. Build micro habits for stress relief. Debt related anxiety can feel overwhelming, but small, consistent practices like 10 minute 10 minutes of mindfulness, journaling, or walking can buffer the psychological effects of chronic stress. Advocate for policy change. On, on a broader level, supporting reforms like medical debt forgiveness programs, price transparency laws, and extended Medicaid access can help shift the burdens from individuals to systems. Would you like to explore how self directed care models or community based interventions might integrate some of these? Uh, integrate some of these strategies. I think your expertise in autonomy and person centered planning could add a powerful lens to this. Absolutely. The relationship between debt and mental health is deeply intertwined and often bi directional. Debt as a driver of psychological distress. Debt can trigger Debt can trigger chronic stress, anxiety, depression, and even suicidal and ideally ideation. The the consistent pressure of owing money, especially when it's tied to basic needs like healthcare, can lead to sleep disturbances, feelings of hopelessness or shame. Social withdrawal and isolation. Strain relationships. 60% of people in debt report frequent disagreements with loved ones. This isn't just accidental. One study found that 54% of US adults with debt feel stressed always or often because of it. Um, to mental health as a contribution to debt. Okay. The flip side is just as important. Mental health challenges can impair decision making, reducing income potential, and increase reliance on debt on credit. For example, depression may reduce motivation to manage finances. Anxiety can lead to avoidance of bills or financial planning. Cognitive overload may impair budgeting or impulse control. This creates a feedback loop. Mental health issues lead to financial strain, which worsens mental health, and so on. Medical debt, a unique burden. Unlike consumer debt, medical debt is often involuntary, occurred during emergencies or chronic illness. That lack of control can intensify feelings of vulnerability and powerlessness, which are core features of anxiety and depression. Okay, debt stress syndrome. Some researchers even describe a condition called debt stress syndrome, where the emotional toll of debt mimics trauma. Responses: hypervigilance and panic, and a sense of being trapped. If you're interested, we could explore how self-directed care models or financial navigation services might buffer these effects, especially in populations managing chronic stress or caregiving responsibilities. I think your lens on autonomy and person-centered planning could offer a compelling framework. Several recent studies have shed light on the powerful and often devastating link between medical debt and mental health. Okay, JAMA Health Forum 2024. This nationally representative study found that 33.8% of adults with medical debt forwent mental health care due to cost, compared to just 6.3% without debt. The likelihood of skipping care increased with the amount owed. Those with over 5,000 in debt were 28 percentage points more likely to avoid treatment. To Johns Hopkins Bloomberg School of Public Health 2024. Using CDC survey data, researchers found that adults with depression or anxiety were twice as likely to delay or skip mental health care if they had medical debt. For example, 38% of those with anxiety and debt didn't seek care in the past year, compared to 17% without debt. 3. Forbes Advisor Survey 2024. This survey revealed that 54% of U.S. adults with debt feel stressed, always or often, and 48% report sleep problems. Debt-related stress also led to relationship conflicts, 60% depression, 34% and even consideration of bankruptcy, 66%. Psychology Today, a gender-focused study explored how financial stress uniquely affects men. It found that cultural expectations around being a provider often led to shame, secrecy, and emotional suppression, compounding the mental health toll of debt. These findings paint a clear picture. Medical debt isn't just financial issue; it's a mental health crisis in disguise. If you'd like, we could explore how these insights might reform more compassionate policies designed or community-based interventions. I think your expertise in autonomy and person-centered care could offer a compelling framework tackling the mental health toll of medical debt. Requires more than financial band-aids. It calls for structural change. Here are some of the most promising policy strategies being discussed or implemented. Expand Medicare or Medicaid and close coverage gaps. States that expanded Medicaid under the ACA saw significant reductions in medical debt and improved mental health outcomes. Expanding access in expansion states could reduce both the incidence of debt and the psychological stress it causes. To remove medical debt from credit reports. The newly federal rule proposed in 2025 would prohibit lenders from using medical debt to assess credit worthiness while it's current on hold. Its implementation could reduce the reduce the long-term financial emotional damage of unpaid bills. Okay, 3, mandate transparent billing and financial assistance. Hospitals could be required to clearly describe financial policies, screen patients for eligibility before sending bills to collections, offer interest-free payment plans. These changes could reduce surprise bills and the anxiety they provoke. Integrate financial counseling into mental health services. Embedding financial navigators in community mental health centers could help patients manage both emotional and economic stressors. This dual approach is especially effective for those with chronic conditions or caregiving responsibilities. Five, support debt forgiveness and medical bankruptcy reform. Policies that forgive low-income medical debt or streamline bankruptcy protections could offer relief for those trapped in cycles of debt and despair. Some nonprofits are already buying and trying medical debt for pennies on the dollar. Scaling this could be transformative. Invest in community-based, person-centered care models, self-directed Medicaid services, and community health worker programs can reduce reliance on costly emergency care, lowering both debt and stress. These models also promote autonomy, something I know you value deeply. Would you like to explore how these reforms could be tailored to support caregivers or individuals managing chronic illness? I think your insights on person-centered planning could really elevate that conversation. Okay, guys, so that is it for tonight. I will see you all tomorrow for shows. For now, Gator Wellness, take care, folks.